And lovely, and that's everyone coming in now. So
See who we know.
right, that's us, Tracy. You can get going.
Thanks very much, Jen, with getting us all set up there. Well, good afternoon, everybody, and a very warm welcome to the Food Train Roundtable, Eating Well as We Age Well and What Needs to Change. I'm Tracy McInnes, and I'm our trustee with Food Train, and I'll be facilitating the conversation this afternoon. We're delighted to have our panellists with us and the audience to discuss this important subject as part of the UK Malnutrition Awareness Week. So I've got just a few housekeeping points to let you know of. So firstly, the audience cameras and mics are turned off at present, but they will come back on at the end to allow questions. There is the chat available to put questions into that. So if you've got any questions as the panellists have a conversation, then please pop them into the chat and we'll pick them up at the end. The event is being recorded and a link to the recording will be sent out possibly later on this week or earlier next week, but you will get a copy of the recording. So I'm going to ask firstly for the panellists to introduce themselves. So I'm just going to go round my screen and do that if I can. Jen, can I ask you first to introduce yourself?
Yeah, so hi everyone, I'm Jen Grant. I am the dietitian working with Food Train, and I kind of lead on our malnutrition prevention work and our kind of initiatives around supporting older people to eat well.
Great, thank you, Jen. Angela, can I come to you next?
Hi everyone, my name is Angela and I own a care company in the north of Scotland in the Highlands. We have primarily elderly people, but we support the younger adults and the elderly in their own homes in the community. So I got involved with Food Train by contacting Jen once to ask if she could help us with training for malnutrition, and that's how we became involved in it.
Great, thank you, Angela. Susan, you're next on my screen.
Hi there, my name is Susan Scott. I'm one of the development workers here at Carers of West Lothian, and we work very closely with our partnership with the Food Train, particularly with our MIST project, the Memory Information Support Team. So I'm here as a voice, certainly for some of our adult unpaid carers.
Great, thank you, Susan. Diana?
Hi, my name's Diana Findlay. I suppose I'm an older person, obviously, but I'm a trustee of SOPA, Scottish Older People's Assembly, and I'm also an Age Scotland ambassador and have been involved in, as a volunteer, looking to the interests of older people for some years, about 20 odd years.
Great, thank you, Diana. Lorna?
Hi, good afternoon, everyone. My name's Lorna Farker. I am a branch manager here at West Lothian Food Train. So we offer various services, including a grocery shopping service, a one-to-one supported shopping service, a friends service, a library service, and we also look at supporting low-level at-home services as well.
Great.
For anybody in West Lothian.
Sorry, cut you off there mid the last sentence. Apologies for that. Thank you, Laura. And Rosie.
Hi there, I'm Rosie McCluskey. I'm the Chief Executive of Food Train, and I'm really delighted that you've all joined here today, and I'm really looking forward to hearing the conversation that we have. So thank you so much for joining.
Great, thank you, Rosie. Well, lovely. Thanks everyone for introducing themselves. I'm going to ask Jen to kind of set the scene of the malnutrition picture within Scotland firstly, and then we're going to go to the roundtable conversation. And then we'll come back to the audience for questions there afterwards. So firstly, I'd like to just hand over to yourself, Jen, if I could, and for you just to set the scene so we've got a clear picture for our discussions. Thank you.
Thank you. So I've got a couple of slides to share, which I'll hopefully winging their way onto your screen just now. And yeah, like Tracy says, I'm really just going to give you a sort of a quick overview of malnutrition in Scotland for older people, a little background on kind of what we're doing and why we're here. So just, I mean, Lorna kind of covered a good bit for us for Food Train anyway, but just in case people aren't aware of who we are, at Food Train, we're a Scottish charity that kind of work across Scotland to support older people, really just to eat well, age well, and live well at home. And through the work of Food Train, Eat Well, Age Well was established as a national project in 2018. And we were really kind of established on the back of a lot of feedback from older people themselves, our volunteers, and our kind of health and social care partners that we worked with, that there wasn't really a great understanding of malnutrition in Scotland. There wasn't a lot of resource available to work on preventing malnutrition. So we were really set up with the aim of contributing to the prevention, detection and treatment of malnutrition among older adults living at home in Scotland. So when we're talking about malnutrition, and I always like to start here because there is oftentimes lots of different ways that we can kind of come at malnutrition and lots of different sort of sub-definitions and things like that. But when we are talking about malnutrition, we are really just focusing on when someone doesn't eat enough to meet their nutritional needs. So that for whatever reason, someone isn't able to kind of eat enough. And with that definition, we know that older people are far more likely to be malnourished than any other age group in Scotland. And we've kind of seen that sort of right across Scotland, right across the UK as well, that it tends to be older people who are kind of most at risk in Scotland. And that's really why we focus on sort of supporting older people in this. We know that malnutrition is very preventable, it's very treatable, but it's only preventable and treatable if we're identifying it early. And that's where kind of a lot of Food Train's work and Eat Well, Age Well's work comes into it, where we are trying to kind of identify people early and give them the support that they need. In terms of malnutrition prevalence, I've just got a few of our stats that we've collected. So we have been collecting some data on the prevalence of malnutrition in Scotland since January 2019. And in that time, we've screened just over 6,500 older people. And we found that around 17% of those are at risk of malnutrition, which is higher than, if anyone's ever heard of the kind of the BAPIN data that's been around for a number of years, the sort of accepted figure tends to be that 1 in 10 older people are at risk of malnutrition. So we're seeing that's a lot higher at 17%. And when you kind of square that out to the rest of the older people population, it equates to around about 170,000 older people across Scotland, which I'm sure you'll all agree is a lot of people to be struggling to eat enough in Scotland. And that's kind of really what we're always trying to do something about. We also collect a bit of information around risk factors for malnutrition. And what we've seen over the last few years as we've been collecting that data is that malnutrition risk really does increase with age, and that as people get older, they are just more likely to be at risk of malnutrition. We've seen that a lack of companionship also increases malnutrition risk. So we've asked our members to rate how often they feel that they lack companionship on a 3-point scale, and so that people who said they lacked companionship often were far more likely to be at risk of malnutrition. The same thing was true around people's health, and we've seen that malnutrition risk will increase as health declines, seeing that those that rated their health as poor being much more likely to be at risk of malnutrition than those who are rating their health as excellent or very good. And finally, we see that rises in the cost of living have also affected malnutrition risk. So again, we've asked people whether they've made any changes to the way that they eat in the last year. And those that said yes are again much more likely to be at risk. So with this kind of information in mind, what we've really set out to do with this roundtable and with a lot of work that we're doing is looking at ways to address these risk factors, looking at ways to support older people to be able to eat well so that they're not at risk of malnutrition, and that they're not kind of going to become malnourished and suffer the negative effects that being malnourished will kind of bring along. And so hopefully hopefully today you're going to hear from all our panelists about the different bits of work that are really supporting older people to eat well. So thank you very much. I'll hand back to Tracy. And stop sharing.
Thank you, Jen. I'll just give you a second to change the screen. There we go. Perfect. Thank you for that. And I think you have summarised what the main issues are in terms of our discussion with colleagues this afternoon, which is great. So bearing that in mind, we'll just move on to the roundtable discussions. And we've got 4 questions to pose to the panellists to hear their thoughts on, and to make the audience think about their views and their thoughts and share any experiences they might have when we come to the end of the roundtable discussion. So the first one is, the question is, what are your experience of challenges faced by older people to eat well and avoid malnutrition? Is there anybody who would like to pick this one first, or will I just come to Angela? Can I come to you?
Yeah, of course.
Thank you so much.
Given that we're a care company and we're in and out of clients' homes, elderly homes, then we see firsthand as well quite often the issues that are there really that's causing some malnutrition in the community. Now, one that we've found particularly is obviously mobility, as Jen said, as age increases, health conditions also more prevalent. Lack of mobility, lack of companionship, what Jen said as well, so social isolation, low mood, not isolated, just mood's low, motivation gone. So they're just not interested in eating, maybe lost their appetite as well, or they have some cognitive decline that they maybe walk away and forget that they have some food on the table. And one of the main issues we have is that we are contracted by the NHS, so we're given a specific amount of time to go in and do meals. That's a real problem, obviously, because we might have 20 minutes to do a lunch or a tea call, and this person's been alone all day. So no, we go in, we have a wee chat, prepare their dinner or their lunch, and then we're leaving them with it on the table, and they just walk away. They don't eat it. So we find that quite a lot. That's a big problem for us at the moment. But we have spoken to the NHS and we have asked if we can do a project of change, that if we identify any clients going forward, can we have the additional time to spend with them? Also, for some people elderly at home, it's shopping. They can't go shopping themselves. We find that the relatives, meaning well, buy food what they would eat, not what our clients would want to eat. So again, they're just not interested in the food, or maybe buying the same thing over and over again. So they're not getting to choose, and they're not getting the choice. So yeah, they're not able to go out and do the shopping themselves. So we're hoping that maybe to help that, we could sit with them and do some meal planning, do some online shopping with them. Again, that's all time that would need to be approved to do that, but that would definitely help with that as well. Yeah, that's it. Financial. They worry about worry about their fuel bills, let alone how they're going to pay for food as well. That's another issue that we have, that we hear quite often from them. And it's just a spiral, really. They're sitting, they're lonely, they've nobody to do their shopping for them, and yeah, that's the spiral. That's what we're mainly finding. On top of the what you'd expect, any like dental problems, swallowing problems. And that's why we approached Jen as well to help us with training, because we just feel there needs to be more training out there, how to identify these people and how to manage it going forward. So that's the main problems that we're finding at the moment.
Great, Angela. Thank you very much. Can I just come in and just ask you about that pilot that you're doing around the timings? Because I'm sure that rings with a lot of people. Can you tell us a wee bit more about that?
Yeah, so we first met Jen in January 25. I think we had asked for, so she did some education to all our staff. They all got the same training. And then we'd for every client we get now, we do a patient assessment, the nutrition checklist. And from the back of that, we identify who's at risk of malnourishment. So we did that in January, we did it again in July. And since then, we've just been thinking of ways that we can go forward to make improvements. We're only a small care company. That's an issue as well. So we need to move it out to other care providers, but that's what our plan is. So as a small test for change at the moment, I approached the NHS in our area, up in the Highlands, and said, this is what we want to do. There definitely needs to change. Can you support us by working with us. So if we identify possibly someone who is lonely, who can't go shopping, who needs some companionship to eat, because that's the main problem. That's what we're finding. They're not eating because we're walking away and leaving them, and they've been alone all day anyway, and then we just split in and out. So yeah, that's been fully supported, and that's something we're looking at the moment. So a very small test, like I say, we're only a small care company, but if that works, and then the NHS up in that area are also thinking, oh, well, they're not thinking, they're going to join the same trial with us with Jen, if that's okay, and maybe get a larger amount of clients. That they support a lot more clients than we do, so it'll be a much larger study.
Yeah,
to see,
and
then so.
Thank you. But then, Diana, would you like to jump in here?
Yes, okay. I mean, yes, because I'm an older person anyway, I can understand to a certain extent. And I'm out and about, so it's fine. But for those that are at home, I think you lose interest. Food doesn't, I think your taste buds change. I know that when I go shopping for food, I think, what do I fancy? And I don't really think of anything. Chocolate, but I'm trying to avoid that to try and become more slim. But do you know what I mean? I know you kind of know what you should do, but in a way, you can't be bothered. But perhaps I think more socializing, if that could be, I'm sure if you, instead of delivering food, is it feasible to pick up a few, take them for lunch in the warm places that we had last year? And I think we're hotting up for places like that this year. If they had one decent meal, they could have a snack in the evening, but one decent meal and the socializing and having fun, I think would make an awful difference. It's a case of arranging it, isn't it?
It is. It's great. Thank you for that, Diane. Would anyone else like to jump in? Susan, Lorna, Jen, or?
I'm happy to certainly have a chat from unpaid carer perspective. Like I say, the project that I am particularly a part of here at Carers of West Lothian is a memory information support team that we abbreviate down to MIST, and within that it's not just unpaid carers, it is the person being cared for potentially on a dementia pathway. And certainly everything that's kind of been discussed, from eating, swallowing, hydration, not just for the unpaid carer, but for that cared for person potentially living with dementia too. I think that there's such a wide expanse of issues, from financial, as I'm sure we're all aware, the cost of simply of going out and shopping, and the dietary requirements of the person living with dementia, as well as that unpaid carer. There's so many issues there. The access to food, whilst we often refer on to the likes of food banks and whatnot, sometimes the delay with West Lothian Council and promptly getting that in place often needs a wee bit of prompting from us, but equally, linking to community shops, to community hubs, to other food sources when they aren't always available, as well as the likes of the food train. So yeah, it's social for us as well. We certainly try to, where we're able, create meet and eat sessions for our unpaid carers to come along, and as you've rightly said, try and create that social inclusion for people who may otherwise be on their own. We do also support bereaved carers, and again we recognise that real need for people that may be bereaved and struggling with appetite and struggling socially to sit and eat on their own. We want to try and create spaces where actually you don't need to. I would love to see that being replicated if it isn't already in other carer centres, but we certainly do really see that. Other things for unpaid carers is that they themselves often skip meals, and we are seeing them themselves lose weight and become malnourished, and then that brings about a whole host of other health conditions for them. And then we're dealing with a dual crisis at that point. So should an unpaid carer go into hospital, we're then also potentially looking at a bed space in hospital for the cared for person, dependent on their health conditions and health needs too. So it's such a complex, wide, varied issue, but there are so many points, and I don't want to take over the whole meeting with all of my with all of these points, but I'll leave that one there.
Great, thank you very much, Susan. I know there is a lot, but there's quite a few sort of themes coming through there as well around that socialisation, the companionship, the low mood, mobility, and that kind of financial concerns as well. Okay, does anyone else want to jump in, or will we move to the next? Yeah, Lorna, please do.
Sorry, yeah, just absolutely mirroring what everybody else is saying, but the other kind of area that I note is when, even though we provide a weekly shopping service and you're asking somebody what they would like from the store, again, what Diana was saying is people don't know. They can't get out to the supermarket to look and see what's on the shelves. We can all do that. We can all go and visually see something that looks, oh, well, that looks quite nice.
Yeah,
You're asking somebody who's maybe not been to a supermarket for 5-6 years and
Yeah,
all they've got is maybe an advert in a magazine or an advert on TV. So they're asking for things that, and that's just not good enough. It's just not good enough. One of the things that we've introduced in West Lothian is the one-to-one shopping service. So we have a lot of people that would like to go around a supermarket, but for mobility, sight impairment, hearing impairment, traffic, just getting bus access to public transport is not an option. So we provide a service where we pick them up and we take them round a supermarket on a one-to-one supported shopping service, and we will try and do things like excite their appetite. The other thing that the challenge is that when people are dealing with ready meals, the instructions on the packaging are so complex. Stir to the left 3 times, add 3 tablespoons of water, put the lid back on, stir it to the right. It's just, it's not good for, and then we try and introduce maybe picky foods. But again, like what Angela says, they might just be left on the side of a table. So there's the other thing, talking about eating in a group setting, we absolutely know that is a massive positive factor in sort of supporting people to eat well. We, in our friends service and along with our one-to-one supported shopping service, we always incorporate a trip to the cafe, a lunch out time, because it's like what Diana was saying, it's about the social interaction and just enjoying, and people will, over a certain age, will eat so well in those kind of settings rather than sitting in a living room with nobody.
Yeah.
We used to provide an Eat Well Buddy service, and again, it was what Angela was talking about, where we could go into the house and we could say, right, what is it you like? What do you enjoy? What do you not enjoy? What have you got enough of? What have you not got enough of? How can we excite your appetite without, making sure that they're eating 5 pieces of fruit and veg? At this point, sometimes it's just about making sure you're having and you're consuming calories with the help of our dietitian and things. That service, unfortunately, is not available at the moment, but it is something that we're very, very keen to reintroduce, because we know it's needed and we know it works well. Plus, you've got the company and you've got the companionship, so they're more likely to kind of have that buy-in when you're offering that level of support.
Mm-hmm. And I think that Lorna takes us very nicely onto our kind of second question, around the second question being, what have you found works well to support older people to eat well and prevent malnutrition? So that kind of budding service that you've just been describing sounds as though it would tick quite a few people's thoughts on that, in terms of that socialisation and that social interaction. But let me open that question up then. So what have you found works well to support older people to eat well and prevent malnutrition, other than the budding service?
We feel that lunch clubs work well. So any of our clients that have gone to lunch clubs, like you say, just socialising with other people works really well. The issue we do have is that sometimes you have to make your own transport there. Not everybody can do that. So we do have some people that just can't go. We used to have a volunteer service where someone would make a meal, just as you say, a meal for one of our clients once a week and go and sit with them while they're eating it, and that worked really well, but that seems to have stopped now. I was speaking to Jen as well about possibly if we could identify some clients in the north, because there really isn't anything for them if that's something that Food King could recruit for, or if we could look elsewhere to try and get some volunteers to do that, because that's about socialising, isn't it? Sitting with them when they're having a meal, eat it once a week even is something. It's better than what's there at the moment. But yeah, we just find that the clients that with us that are more malnourished don't have the family support to take them places or to go in and spend the time with them. And we've also found as well that the education, like even though I've spoken to all the care companies, it's with no standardized education on malnutrition at all. And I think it just needs standardized. We all need to be able to identify the risks of malnutrition and know what to do and take that forward. And the training's just not out there at the moment. Obviously, we've had that training from Jen, but it's not standardized across the NHS. So I think that would really help. And that's for families as well, for the families, for the clients, for us. If we could just, when we first start our client, go in and do a thorough client initial assessment, have the family there, give them leaflets, talk about malnutrition at that stage, then that would really help as well. It's just education, I really think.
Angela, thank you for kicking us off there with that question. Diane, did you want to come in there? Oh, sorry.
I was just going to say, I mean, I'm thinking back to years ago, when people seemed to survive very well on, pots of broth and porridge and really basic food, which was nourishing. And that is not difficult to provide lots of that sort of thing. I'm not saying porridge, that's not everyone's cup of tea, but we're in Scotland. But broth, and very poor people manage to do that, and it doesn't cost a lot. I just, I notice here there are a couple of cafes, I'm down in the Borders, who I notice are doing half portions for older people. And obviously that costs less. And that's helpful for those that are mobile and able to go out. Because I don't know about you, but I was brought up to always clear the plate because I think of the starving millions.
Absolutely.
And so you feel guilty if you leave food on the plate. But if you get a giant portion, it can put you off. So that too is, so there are all sorts of little things that you can do.
Absolutely.
But difficult, isn't it?
It is difficult.
It's time and people that
it is
short of, isn't it?
Yeah, thank you, Diana. Susan, you've got your hand up.
There. Yep. Again, a very loaded question, I think. I think that from our perspective, as I mentioned earlier, the social interaction is very, very popular, and I think creating more opportunities for social meet and eats, not just for unpaid carers, but for wider people. And I think coming out of COVID, we were probably a little bit better at having warm hubs and soup kitchens, and I'm sure they are still out there, but maybe making them a wee bit more well advertised and well known. I also do wonder if, like Lorna mentioned earlier, that the funding and the resources available for such vital services, because we often referred on to that one-to-one buddy shopping service, and certainly it's something that we are recognising for people that go on to get a dementia diagnosis, whether it's recent or whether it's 2 to 5 years down the line, is that sometimes there are instances where people are losing driving licenses, and if there's only one member of, say, spouses that can drive, that suddenly, it's not just one person that isn't getting out to the shops, it's actually potentially two. So again, that risk of malnutrition is real, and there is a generational aspect. I think that there are a great deal of older people who simply think that services like the food train aren't always for them, that there's somebody more deserving, and whilst we try to battle against that and say, no, these services are absolutely for you, there is this, no, I don't need that, somebody else would benefit rather than me. And I think it's about information, I think it's about raising awareness, I think it's about education, and we have worked very closely with Lorna and Jen in creating two fantastic fact sheets around helping people eat well and drink well when living with memory issues or dementia. And I think these are the types of things that ideally we want to be getting further and wider out, not just across West Lothian, but across Scotland.
Great, Susan, some great points there to pick up on, so thank you. Jen, Lorna, Oh, Jen, do you want
Dave,
to?
can I just come in? Really, just to second again, I think we're all going to sort of talk about a lot of the same things as working well, but I would just say we really do know that raising awareness, that education, and more importantly, sort of early identification of issues is something that works well. You know, we're seeing it through obviously the work that Angela's doing within her care company, but we've ran, you know, several different kind of projects across Scotland now. The one we have the best kind of data back from is a project that we've been working with Renfrewshire Sheltered Housing for a number of years now, where we implemented a bit of training and a bit of ongoing education so that their staff could use a really simple screening tool to kind of identify people who were at risk of malnutrition and do something about it. And they've seen a really significant decrease in the amount of issues that are coming up. You know, when they started, it was around about 13% of their tenants were at risk of malnutrition. It's now sitting this year at 2% are at risk of malnutrition, which just, I think, really shows you how much that kind of awareness happens and can really kind of help. We also see through Food Train, through like our Meal Makers project, where we match volunteers with older people to do, as Andrew was saying, you know, to provide that one meal shared a week. You know, so it's a volunteer taking a bit of time, preparing an extra portion, and then sharing that with the older person that they're matched with. And we see really great outcomes, really great stories coming out of there where we're getting the social aspect of it. You know, where people are building friendships and relationships, and we are seeing some really great work that's happening in sort of pockets across Scotland, which is always good to see, but it's a shame it's just happening in kind of pockets. So we do have things that will work. It's maybe just getting that kind of spread across the rest of Scotland, hopefully.
Yeah, that's probably the challenge, isn't it? You know, and if that maybe takes us on to our third question around what challenges exist in delivering these project services. So we've talked about some really good examples there of what does work well for older people. So how do we make that spread across Scotland? Or what challenges exist in delivering those projects?
Money and good management, I suppose, but it's money really, basically, isn't it?
Not financial. Everybody's nodding their heads simultaneously here.
Because it's all
Right.
time and that has to be paid for, isn't it?
Okay.
Yeah,
Thanks.
I would agree. Sorry, I would agree as well. It is financial. We are hoping to do some sort of sponsorships and try and raise some money that we can put into the wee project that we're doing as well to try and make things better. But it does cost money. We're also employing where we have someone who's a nutrition champion.
Oh yeah.
Who will follow up. So it's not just a case of identifying this early and saying, this is what we can put in place. It's by continually going back to the home, speaking to the family, speaking to the client, and seeing if improvements are being made, and also liaising with the staff that support that person. So again, it's all financial, but we just need to find a way around it. And if we can raise some money by sponsored walks or whatever it is we do just to support that, then that's what we'll do. That's what we'll do. And then just having that time as well to sit, like I say, meal planning and taking them shopping and doing all the things we've all spoken about, really. So I think the main problem is financial.
Okay. Lorna, sorry, I didn't see your hand there.
Yeah, I was just on the back of, I agree, absolutely, it's a financial thing to support some of these projects, but I would also add to that, I think there's we need to work on saying that to the message that we share with older people, to say it's okay to be able to kind of put your hand up and say, I could do with some help here. They're a very proud generation. They're an independent generation, and we do a lot, I think, in terms of supporting the message it's okay not to be okay. We do that very well. but I think this age group is a little bit forgotten in saying, you know, I could do with some help here, and realizing that maybe they do need help is a great starting point, because a lot of people will malnutrition. Oh no, that's no me. I'm fine. I eat loads, and it's just like, well, actually, you don't, and you are, and that's something that we can help with. So maybe there needs to be something around a sort of comms package, or our messages that we put out, and maybe that's the starting point.
Yeah. Okay. Thank you, Lorna. Susan.
Just dittoing exactly what Lorna said there, we are very aware that obviously as our generations are growing older, that we are supporting working carers, so people of working age. And I think this idea of, again, yes, we're looking to support older people, but I think raising that awareness with adult children who are maybe caring for elderly relatives of these services and of exactly what they do. And I know that the food train services are much more expansive than simply just that shopping service, but I think reiterating the importance of, like I say, the buddy shopping service and how much of a loss that was when that funding ceased, and how vital it is to bring these back into fruition for the benefit not just of the older people, and yes, obviously to avoid malnutrition and the risk of dehydration and whatnot. But I think, you know, that peace of mind for family members and knowing that their loved ones, that their elderly relatives are getting attended, that they are getting, you know, a bit of companionship while that volunteer is there assisting with what it is that they do. Because it's much more than just a shopping service. It goes far wider than just that. But yeah, I think it's the challenges are always funding, it's always resources, and because of funding pots now becoming more wide to include the likes of, I'm sure across a wide number of local authority areas, there are an awful lot more charities appearing and growing and developing, and therefore the funding pots are getting smaller for a wide range of charities, not just small, medium or large, it's all.
Okay, Susan, thank you for making those points as well. Jen, can I come to you?
Yeah, I suppose probably kind of springing off of what Susan's saying there is, I think as a kind of a nation, when you look at the way that our health and social care services are designed, when you look at the kind of the policy landscape, we've not had a very great track record of preventative care. A lot of services that exist, and sometimes, you know, ours within Food Train, you know, other places as well, it has been a very reactive approach of, you know, someone's having a problem, let's do something to fix that problem. And then you're not actually doing anything to stop the root of the problem. There's not, you know, what is being done when we're talking about older people who aren't managing to get to shops anymore. We see a lot of people who are living a bit more rurally, a bit more out of the way, having bus routes changed, you know, aren't able to then rely on public transport the same way. We're kind of seeing sort of issues around housing, we're seeing issues around how people can access healthcare. There's not always that kind of focus in on preventative sort of work, and we've kind of seen how, you know, getting a bit of support early, be it via getting your shopping so that you can focus on something else, or being able to access, you know, advice and support through something like MIST, can be really helpful. And there's not always the focus on there. We're kind of seeing a bit of a shift in attitude, but that isn't always sort of flowing its way down through policy. We get some nice sort of headline bits of, you know, we want to take a preventative approach, but then there's nothing that really flows through policy that then causes sort of people to kind of take notice of it. One of my ongoing sort of bugbears that exists when we look at implementing screening is that a lot of places do not have sort of policy strategies. You know, when we look at, like Angela was saying, other care providers, it's a very ad hoc. There is nothing sort of centrally that suggests it would be good to look at malnutrition prevention. There's nothing that really, the care inspectorate does a bit of prompting for us and spreads our message a bit, but it kind of comes down very much to individual organisations, and you need one person, you know, doing as Angela's done here, is like, let's get a nutrition champion in, let's look at how we can support things. And that is a great bit of work. It relies on one person to do it. And if we've not got that kind of policy backdrop, if we've not got that sort of, be it national, be it local, drive to help organisations shift to prevention, to do a bit of work, which again, I suppose is money and things, then it's never going to work in a kind of a longer term sort of way.
Okay, Jen, thank you for that. Just picking up on that central driven in early intervention point there. So great, thank you. Diana, you will just come back in.
I'm not a fan of centralising and everybody, say in Edinburgh, making decisions, or Glasgow, wherever it is. I think we need to bring it back down to communities or whatnot. I'm wondering if you're tying in with community councils, which that's smaller, and within, say, a village, getting the people to look after their own, so to speak. Because nowadays families have dispersed, haven't they? You haven't got, as people used to, the whole family stayed in the same area, so they'd look after mother or father or whatever. That's gone now. So the older people are more vulnerable, especially the rural ones. I mean, if they've worked on the land all their lives, they've maybe still got the cottage they were given by the farmer, the estate, with the big garden where they grew veg, but now they're not fit to do that. And transport is poor. I mean, you look at every aspect needs attention, doesn't it? So it needs maybe local people to look after their own kind of thing, to be encouraged. I suggest, I don't know, but
Thanks, Dan. Absolutely. Absolutely. Susan, did you want to come back in?
I just wanted to hop back in around the fact that within MIST, obviously, as I've mentioned, we're not just supporting the unpaid carer, but the person living with memory difficulties or a new dementia diagnosis. And we're very fortunate in that we're one of the few projects within Carers of West Lothian that actually get out to go and do home visits. And certainly something that myself and the member of staff within the same project is that we are taking out checklists around how somebody's drinking, how somebody's eating, how alert they are, has there been any weight loss. And I do just wonder if, frontline members of staff, whether it's a care provider, whether it's somebody from social work, whether it's somebody from a home safety service, if there could be something more widespread across the board, and that if there is somebody to go out and do a home visit, irrelevant as to whether it's a carers organisation or somebody from social work, if that standard could be across the board. And I know that is probably very much a wish list item, but I do just think that there's a wider scope there to be had for people that are in people's homes, that are seeing changes, that are recognising weight loss. I just think there's definite work to be done there.
Yeah, no, valid point, Susan. Thank you. Thank you. I think we've covered that, and certainly one of the big issues coming from that conversation was around the time and the financial resourcing of taking projects forward, but also that early intervention, looking at centrally and locally driven activities as well. Oh, Rosie, sorry.
It was just to come in before we round it up. We've got a question in the chat to say, has any of the panel seen an impact of age-related eye conditions on food intake, like cataracts, glaucoma, or macular degeneration, meaning that people can't see what they're buying or eating, or for people with dementia, there's not enough colour contrast between the plate and the food, and also thinking about the often very small print of labelling in shops and on food labels, information is not accessible.
Okay, thank you. Thank you, Lorna. Did you want to come back?
Yeah, just quickly on the back of that comment, Rosie. When we were doing the Eat Well Buddy, that's when we really kind of picked up on those kind of major issues for older people, and it was such a kind of breakthrough to problem solve those, because we were there to kind of help. Not by that stage, those conditions are already in place, but we could certainly help with. We did some training with Sight Scotland, who were able to give us some hints and tips for the volunteers who were going in. That was extremely relevant and very helpful. you know, you're asking people to write a shopping list or to manage cooking instructions that have a visual impairment. So that's difficult. We also did things like we signposted to make sure that the correct lighting was in the home, so that was going to help. So it's just a minefield when you really start kind of scratching the surface. So I think that's a very, very relevant comment, and just adds to the challenges I think that are there for problem solving.
Great, thank you for just picking that up for us, Lorna. Thank you. Okay, so we have one last question for the panelists before we open it up to our audience, and that question is, what do you think needs to change in the future, or what are you looking forward to in the future to help support older people to eat well? So again, a big question, like the others. So they're all big questions.
Solve all the problems that we've talked about.
Yes, we've talked about kind of what the challenges are, what works well, what do we need to do to try and help the spread of projects, but what do you think needs to change in the future, or what are you looking forward to in the future to help support older people to eat well?
I think more working together. I mean, just what you're doing now is everybody talking about it and putting the problems on the table, and we're all agreeing what the issues are. It's quite widespread, isn't it? So, like for us, for example, casting a wider net and involving other care companies to come into our little project and be more educated and taking that forward. But that's what I'm looking forward to see where we can go with that, to sort of educate more people, and just identify more people at risk. And I'm quite interested as well in what was said about preventative measures as well. I think that's really important, and not something I've totally thought an awful lot about, to be honest, until it was mentioned here now, is like we're talking about identifying people at risk of malnutrition, but what can we do beforehand as well to prevent that? So I think more working together, for definite, because it is quite sporadic, especially with us in the north of Scotland. Like I said previously, education, that we're all standardised education. Everybody has the same understanding and works together to make improvements.
Yeah, valid points indeed, Angela. Absolutely, thank you. Susan.
I think just echoing exactly what Angela's just said, I think partnership working, and when I say partnership working, I am talking across all boards. Like I say, the MIST project, of which Carers of West Lothian are the lead organisation, we work so closely with the food train. We work also with another older person's charity here in West Lothian, and we work with an NHS memory treatment service partner over within NHS Lothian. But I think, you know, having a scope not just of third sector charities, but health and social care partnerships, local authorities, everybody having a voice collectively together. I think the way that charities and funding and availability of resources, I think pulling together now more than ever and having a standardised response across third sector, but also health and social care partnerships is so vital at the moment. I think often people working in this sector all want to improve the lives of older people, and I think doing it jointly together has got to be the way forward. And I will say the partnership within this project has certainly been phenomenal, and the uptake and the interest in it, and I think we do all work incredibly well, and I really do see that working so well to support other older people, not just within memory issues, but right the way across the board. I think there needs to be a collective voice.
Collective voice. Susan, thank you for your thoughts there. What's echoing what Angela said, very much so. Jen, did you want to come in next?
Yeah, I was just going to say, I do think there is the start of a shift. You know, I started working with Food Train sort of 6 years ago, give or take. And at the time, from the job I came from before, I had left that job because I was so incredibly frustrated that I kept receiving referrals for older people who had lost, you know, stones and stones of weight, who had apparently just been sitting at home, unable to get their food until someone decided that, oh yeah, we should maybe refer that person to the dietitian. And when I kind of came into Food Train, the amount of people that I was kind of telling about malnutrition for, the first time, that there was issues with older people's nutrition, and it seemed like it was the first time they've ever heard of that, to now there has been a shift. More and more people are aware, more and more people are looking to do something about it. We're starting to see that kind of preventative agenda coming through the kind of the population health framework, through the Good Food Nation Act. We are starting to see that. I would argue that in a lot of areas it still doesn't go far enough.
No.
But we're starting to see that turn, which is a positive for me. We are getting people, like everybody on the panel, that is working to support older people to eat well, and we're seeing people with the kind of the drive to make that change. And I am excited to see where it kind of goes in the future, because as we kind of make more and more connections, I've kind of seen bits of chat popping up about what's happening in other areas and things like that, and hopefully we can kind of take the things we've learned today and use that to kind of keep driving the projects that we're doing forward and into new places and things like that.
Yeah, I think this is, Jen, this very much is the start of the conversation, isn't it? In that with partners, to get that collective voice and action, which is super. Lorna, did you want to come in at all? I can't remember if you've come in or not. Don't want to ignore you.
Nope, I'm fine.
You're fine, absolutely grand. Yes, Diana.
I was going to say, remember we have older people's champions in 21 of the
Yes.
councils. I mean, we need to be taking this information to them so that because they're in positions of power, authority. I don't know, but do you know what I mean? And
Yes.
it's a case of putting it forward. I do believe in sharing information, and if in one area they're doing something really clever that's working, let the rest of us know, and perhaps it's instead of inventing the wheel all the time, that so I think partnership, perhaps even bringing in local commercial business assistance, especially if they provide food, or do you know what I mean, if they sell food and things. So it's looking at all sorts of different angles, but it's taking, someone's got to make the effort.
Absolutely.
And people are quite pushed anyway.
Right. Would anyone else like to come in before we close this part of the workshop? Everybody said what they'd like. Oh, Rosie, yes.
Can I just pop in just with some bits from the chat
Please
that
do.
we've had? So there's been some bits of chat about local initiatives that's been around, and people may want to use that and raise the stuff themselves when they do that. But we've got a couple of questions in here. And one of the questions is, has any of the panel seen an impact of age-related eye condition? Oh, I've read that one, sorry. Have the panel thought about how the requirement for councils and health boards to develop Good Food Nation plans under the 2022 Act might be used to try and address some of the needs we have heard about today? Which is an interesting question.
Isn't it?
On an almost daily basis.
I don't know.
I think that with the Good Food Nation Act and local authorities, I think it is a really great opportunity to look at how we are providing food, where that food is sourced from, and how people can access that food. Certainly, I think it is one of those things where I think it makes people think about it, and I think it's a really valuable opportunity to actually have a look at what the issues are in the local areas and how they will address them. Because yes, areas, what's going on in the borders is going to be different from what's going on in Glasgow and things like that. But I think there is that kind of a common thread that looking at, how are people, how are your older people accessing food? That was one of our sort of bits of criticism for the larger Good Food Nation plan. Is how do people access food? Are we actually ensuring that people can buy their shopping, and do they know what's available? Do they know where they can actually get that? What foods are available in supermarkets, in schools and in hospitals and things like that? I think it's a really great starting point, and if it's used properly, can be very well utilised.
Thanks, Jane. We've got another question here, and it's, are the panel concerned about the prevalence of ultra-processed food in older people's diets, particularly those who lack motivation and or the ability to cook and will mostly heat up ready meals? Research publicised today raised further concerns about the health risks from ultra-processed foods.
I suppose so. And it's
Susan.
Hi there, and I know that this was something that Angela very briefly touched on earlier, but it's certainly something that we are seeing. Maybe some of our bereaved carers in particular often opting for ready meal and highly processed foods, and often for them it is actually also a slightly cheaper option than building or piecing together an actual meal. And whether they do that because of their physical or mental health, whether they do it because they are on their own and it feels like a waste to make a larger size meal for one as opposed to batch cooking. So again, I think there is an awful lot of work there around education and availability of foods and access to food with the likes of food train and whatnot. But yes, it is something that we're aware of, and I do also think that packages of care, like Angela mentioned, these very brief social visits around meal prep, these support workers simply don't have the time to be necessarily assisting with making a more nutritious meal on such limited time, where they're dashing from one side of locality to the other to assist an older person, and that's simply not okay. We are seeing people in really dire circumstances, whether they're on their own, whether there's two very older people living together who can't manage to simply cook or even microwave a meal. They're maybe being offered a plastic wrapped sandwich and not always the most nutritious at that, and it's really, really heartbreaking. So I don't know what the answer is to that. I think there's just an awful lot of work and awareness raising and referrals onto agencies like Food Train to assist in instances, but there's a big gap there, and certainly concern from us.
Yeah, absolutely, Susan. Thank you for that. Lorna.
Yeah, I mean, Susan's already said part of what I wanted to say, but just a wee example. This week we supported a gentleman who we signed up and we were organising his shopping list for this week and found out that he has no microwave, no kettle, and no fridge.
oh God.
So we had to then try and work with, okay, where we're going to get this, chap. So obviously we've been in touch with the social workers, but these are the people in our community where it's not about the nutritional content. It's just about making sure this very isolated gentleman, and he's not the only one, has something in his belly, basically, until something can get sorted for him. So that's kind of where we're at.
Yeah, so it's taking it right back, isn't it? Thank you for that example, Lorna. Okay, I think we are finished with the round table, just checking no one's else got their hand up. So thank you very much to the panel for just dealing with those questions in the first instance. We're now going to open it up to the audience. So the cameras and mics should now work. And if anyone does have from the audience have a question, if you don't mind raising your hand, I'll try and find you and we can ask the panel your question.
We can see their faces.
So,
yeah, I've got to go to another meeting.
Jen,
There's Chris Story, you've got your hand up.
Oh, Chris, sorry, I'm not seeing people's faces here at the moment. Oh, I do now see Chris. Welcome. Sorry, I didn't see you there.
This is a question for Lorna, really. Lorna, you guys, your volunteers, your team are on the ground every single day. What do you see as the actual human impact of when issues around malnutrition are tackled, both on the well-being and their physical health?
It's huge, Chris. It's such. Listen, we have people who place an order who maybe don't need anything, but it's just having somebody to visit them. It, just a friendly volunteer to chat the door and ask how they are and make sure they've got a couple of wee bits and pieces in for the week ahead. Regardless, I mean, we spoke a lot about people's appetite, people's excitement towards food has diminished for whatever reason, mental health, loneliness, isolation, poorly fitted dentures, upset stomachs, whatever it might be. But just that human contact, and that's where the volunteers will spend extra time with people. They will raise concerns to the office, and we can take that forward. Where we will keep funding applications going for the Eat Well Buddy, which is why we've introduced lunch trips into our friends services, which is why we've introduced cafe visits to the one-to-one supermarket shops, just to bring those connections together. I'd love to do more of it. Of course I would, because I can see the benefits of it. And like Jen was saying about when she started with the food train, when I started with the food train, and just seeing how we've developed those services and where we have tried successfully to plug the gaps, but there's a hell of a lot more plugging that's needed, which is why things like today is fabulous. I hope that's answered the question, Chris, as best I can.
That was great, thanks.
Great, thank you, Chris, for the question. Oh, Sinead, do you want to come in?
Oh, my camera is very low there.
Hello there.
Hi there. Thank you so much. First of all, it's really insightful. Sorry, first of all, I'm Sinead Eccles, senior lecturer in the Open University in the School of Psychology and Counselling, but I also am the Ireland lead for the Take 5 to Age Well campaign that's run twice now in 2023 and then recently May 2025. One of the pillars is around nutrition and doing that. And I suppose for us, and I love the fact that you're talking about social groups and all of that, and having those people around you. We have a barrier like digital literacy, and is obviously a barrier to us to run something like that. So we are working on that and champions and trying to get into spaces where we can sort of, and then so we're doing that work. The other side of it is I have a background in neuropsychology, but biological based eating disorder. So I did an intuitive eating counselling training, not to be a counsellor, but to understand and practice. Is there space in that? Because and I think Diana had actually said it, where we've been taught to eat till our plate's full and we don't listen to our body. Is that a problem that's further down the line and we've got so much to fix first? Or is that something that you feel that there's a space for that within, again, taking the fact that we're in a cost of living crisis as well, that might not be the ideal time when audiences matter, but there's definitely a space there to recognise the importance of how you feel, or is that future plans, or maybe in 10 years from now?
Would anybody like to take that question on?
Yeah, I could come in just on that, because I think that's like actually incredible. You've hit on a niche of my own interest. Because I think it's really interesting when you look at like we've been talking about people's attitudes to food, what people know about food. I think that kind of often happens is everybody assumes, whether it's a health and social care professional, volunteer, person in the shops, whoever it is, everybody sort of assumes that everybody knows how to eat well. That they know what healthy eating is. And like Angela says, even if we take it right before we even talk about being at risk of malnutrition, thinking about supporting people just to eat well and to access like a well-balanced diet. Certainly we've seen in the last sort of few years or so, more evidence coming out that older people need more protein than their kind of younger counterparts. We've seen information on how we kind of break down and absorb nutrients differently, all things that are kind of affecting how you would actually go about eating well. And I think that all kind of comes in with what you're saying around intuitive eating is how we've grown up with eating, how you have perhaps lived, like Diana's saying, you've got to clear your plate. Something that was, it was even when I was a kid, and recently I've had to tell my mum to stop when I go round to her house for dinner. I'm like, I need you to stop plating my food because I have to finish all the food that you've eaten, and you're just giving me like far too much here. And it's all these things that kind of come together. I think it's really valuable to actually look when we're talking about eating well, is looking at how we feel about eating, what knowledge we have, and some of that works very nicely in with preventative projects, where before you even get to the malnutrition side of things, thinking about how we're supporting people to actually improve the balance of their diet, be that like your Take 5 to Age Well project, things like that, making a small change, something that you can do and support people to do it easily, will have such a great knock-on effect when we're talking about malnutrition as well. I hope that answers that.
No, it's just great for me to hear your work. Could there be places for that too? Because I think that there's the information, it's saturated with information about what you should eat and what you shouldn't eat, and it's kind of like the thing I like about intuitive eating is no food is necessarily bad unless you've got a medical condition. It's about enjoying it too and having that positive relationship too with it, and thinking about how it nourishes the body too. But it's a hard sell because there's so much other stuff that needs to be covered too. But I think there might be a place to bring that into other future things as well. So thank you very much, Jen. That was great.
Great, thanks.
I think just before we move on, I think definitely into groups like within Food Train, we've got like friends outings, we've got kind of different times where older people are coming together. I think conversations like that can work really nicely in there. But sorry.
No, not at all. Diana, yeah.
Can we have a copy of your little presentation to share with others? Because I couldn't take all that down, Jen. The little presentation you did.
Yeah, absolutely. It'll come round with all the recording and things like that.
Super. Thank you.
Right, thank you. Any other questions from the audience at all? Anything you want to pick up on, or just have? Oh, Emma, welcome. Oh, you're on mute, Emma. Sorry.
Is that it?
Yeah, that's you.
You're on.
Oh yeah, good. Sorry.
Not at all.
And sorry, I was late coming in because I couldn't get the thing to work. So oh God. I've got a very simple question, but I'll set in. I'm working on a project called the Healthiest Town Aberfeldy, which is it's in Aberfeldy and the area. And food is one of our areas, and and older people as a group we've identified. So I'm not an expert in this at all, but we're looking at how to enable our community and our older people within that to access good food. And we have been asked, I just thought this might be interesting, we've been asked to write a local food plan, which is to try and identify ways that we in the community, we as a community, can deliver the Good Food Nation Act and plan, and rather than it being left to local authorities and NHS boards. So that's quite interesting, and as I say, older people is one of the kind of things. Anyway, the question I just wanted to ask, which somebody may have said and I missed, and I apologise for that, but is the issues around food and older people and malnutrition greater in rural areas than in urban areas? Yes, you're nodding your head. And is there any additional kind of work or support or stuff going on around that difference between rural and urban areas in this?
So data-wise, because we collect a bit of data on people who are at risk of malnutrition, and we kind of map that across where our members live and things like that. There isn't necessarily an actual bit of data that says that rural people are more at risk. Anyone can kind of be at risk of malnutrition because of a variety of reasons. What I will say is many of your risk factors, so we know that people who are older, we know that people who are in poorer health, we know that people who are lonelier and more isolated, people who are maybe being affected by like cost of living rises and things like that are more likely to be at risk, which I'm sure if you're thinking about rural communities, you can see why some of those things are a bit more prevalent in your kind of rural communities. We certainly, we might see a bit more loneliness isolation, we might see sort of a slightly different struggle in getting to the shops. And certainly I know through like food training, the shopping service, we kind of deliver in the areas that have a branch, we kind of deliver sort of all over the place, including out to rural areas and things like that. It tends to be more around sort of tackling those risk factors that we see that works quite well. So I would say there's probably nothing specifically being done in rural areas that's necessarily different. It's more and the rest of the panel might disagree with me here, but it tends to be more how you apply the interventions, because that might, where people are living, might impact what access they have to things. But I don't know if anybody else has got thoughts on rural.
You just lost Isabel from the Highlands.
Also we have.
And we serve both in urban areas and rural areas, and we haven't seen much difference at all. I agree with what Jen says. Again, it depends how close families live. If the person lives rurally, then they may not have any family members or neighbours, even the people really live quite rural, to help them. So that's another factor that we found. But apart from that, we haven't noticed any difference in the numbers.
It was really, I suppose, just around access, and somebody mentioned about transport and about, all the other sort of wider factors that enable people to access food, and the quality of food, in rural supermarkets, the quality of the food generally, the fresh food could be less, and that's not just for older people, but, and delivery services might be less available, etc. So I guess I thought there would be a difference. So it's interesting and surprising, but that's probably, hopefully, a good thing. Although, yeah. Anyway, thank you so much.
Thank you.
Interesting.
Thank you, Emma, for your question.
Can I just say, I think that if you're in the town, old and a bit frail, you can perhaps still totter along to a shop and buy stuff. If you're in the country, transport is a big problem that always comes up when you speak to older people, and voluntary transport's there, but you maybe don't have enough drivers, again, down to volunteers. So again, they're a little bit more, I'm a farmer's daughter, so perhaps I'm slightly biased, but I sort of see that the rural older people, the poor, if you've got plenty of pennies, then you're okay. You can pay for things and whatever, but it's the ones that are less well off. Do you ever talk about, to those that are a little bit hard up, suggest that pension credit might be an awful help? Because we've tried to push pension credit, and it's not charity, because they don't like that. It's what you've worked for all your life and paid into it, so it's your right, it's your due, and it can make an awful difference to people that are hard up.
Yeah, hi Diana, can I just come in there just to say around the pension credit as well? We know that older people are less likely to claim the benefits that they actually need. So what we do as part of food training is we've got some specific advisors working with our older people to give that advice, and also energy advice and things like that as well. But we still see that it's older people there who are less likely to claim that, and that's about them thinking actually there's other people that's much more deserving than them and all of the rest of it. So I think there is definitely messaging that needs to happen around that.
Yes.
Yeah, absolutely, Rosie. Thank you. Susan, do you want to come back in there?
I just wanted to comment off the back of what Diana said there.
Yeah.
In West Lothian, we have very kind of branched out little villages and little towns, and what we are recognising is that whilst they might not be able to get themselves to a larger supermarket, Scotmids, cooperatives, there are these smaller independent chain supermarkets or mini shops, as I would call them, but they aren't always cheapest, and they might have member prices, but for people that maybe aren't members, people could be going in and filling a bag for maybe 20 or 30 pounds, as opposed to if they went to a larger supermarket where they could be getting almost double that if they were to buy their discounted foods and whatnot. And again, I just feel like there's an onus put on older people who maybe can't get further afield and therefore do go locally, and it isn't always most cost efficient.
It's not the cheapest way. No.
Yeah, no, a valid point again, Susan. Thank you. Thank you. Any other questions from the audience? I'm not seeing. Your last chance to ask your question.
We've got something coming up in the chat, and it's from Isabel. She had mentioned it earlier on. She mentioned earlier in the chat about local authorities have welfare support teams. Here in the Highlands will help to look at whole benefit advice to residents. I didn't realise this happened, so I would be referring folk when I speak with them to get updated and checked out. We've a large number of older folk not taking up benefits. Community partnership groups could also be updated about the topic about malnutrition. So that's a comment from Isabel in the Highlands.
Right, thank you. Okay. Any last questions before we bring it to a natural end? Nope. Okay, well, I will just bring it to a natural end then, if I can, by firstly thanking the panelists for their time this afternoon and for taking the questions and just discussing it and bringing together this rich dialogue, and also to our audience for questions and your participation on the chat as well. So thank you very much to both groups. Falling out of today, we will be circulating the recording. You'll be sent a link to that, hopefully within the next few days. It should be quite easy to do that. But we'll also be producing a briefing, which we will share. That'll take us a wee bit longer to pull together, but we will share that with participants, and we'll also be sharing that with our own external stakeholders to use as an influencing tool. So that's what really will fall out of today's conversation. But really, thank you so much for being so open, for putting your thoughts over, both in the chat and also in discussion with our panelists. So thank you very much indeed. We will now close the meeting officially. So thank you very much.
Thank you.
Thank you.
Thank you. Thanks, Susan. Thanks, Diana.